Hey, what's up, Black Dot Media? Back in the studio, back in the booth, bringing out you back with another issue. My issue today, I want to talk about Obama and his healthcare issue. Obama did a speech last week. Actually, it was this week. He did a speech in reference to healthcare. This week, he's been really pushing and pushing, giving speeches in different cities in reference to this last push in reference to healthcare. They're trying to get this thing passed this weekend. I think there's going to be a vote Sunday. They're trying to get this thing passed. Now, the whole issue with healthcare, I think Obama is really adamant about this because this is really a major issue, healthcare, and a lot of people are torn as far as if this is going to be beneficial for the American people or is this going to help out people that don't deserve it. I mean, the healthcare issue is really, to me, I think it's a simplistic issue. I think it's an issue that is really a given. I mean, every citizen of this country deserves adequate health care, access to adequate health care. Wouldn't you agree? Don't we all deserve health care in this country? I mean, Obama is actually doing something that is going to change the way we provide health care in this country. Now, Obama, right now, a lot of people are against his plans and what he wants to do with reforming healthcare. But I think more people do support him and what he's trying to do in his efforts. He's trying to change the healthcare system and make it a system where people don't get abused by the healthcare system. People that are poor don't get kicked out of the system or turned away from the system because they have no money, because they can't afford coverage. And the poor, I mean, really, you think about it, the poor, those who can't provide or have actually those that can't provide health care for themselves, they don't have money to pay for it. Those are the people that really should be looked after first. Poor people, people who don't have sufficient means to provide health care for themselves, their jobs don't provide it, or even if they don't work. A lot of people don't have jobs, a lot of people aren't working, and a lot of people aren't going to the hospital because they don't want that extra bill. And a lot of people suffer because they can't afford adequate health care. Now, there was a statistic that I seen in reference to healthcare that somewhere around, I think 45,000 people die a year because of not having access to adequate health care. But that's 45,000 people die because, and 17,000 of that number are kids, children. I mean, 45,000 total, but 17,000 are young people, young kids that could have been possibly saved if they had access to adequate health care. Now, that's a large number of people, and I don't think anybody in their right mind can say that if that was their son or daughter or their mother or father or their relative that died, that they wish that they could have had some kind of adequate health care and they could have probably prevented them from dying. Come on now, I know people don't want to see 45,000 people die in this country every year because they didn't have access to adequate health care. Now, what sane person wants to see that? Come on now. I know people aren't that heartless where they want to see 45,000 people die every year. 17,000 of those people are kids, young people. Does that make sense? When those deaths could be prevented? No, it doesn't make sense. Or maybe there are people out there that want to see people die and suffer because they can't or they don't have access to health care. Maybe there's people out there who like to see suffering of young people, kids. I asked this question: if that was your kid that didn't have access to health care and died from not having access to adequate health care, how would you feel? Yeah, that's what I thought. I know when it becomes personal, when it becomes somebody in your family, relative, that's when people's whole opinion changes. You know, when it affects them personally, that's when they do a 360. I bet you the majority of the people who are against healthcare reform are people who can afford healthcare, people who have access to healthcare. Those are the people, I bet, who are out there complaining about what Obama's trying to do as far as healthcare reform. Now, you know, this is an issue that people need to come together and try to understand that healthcare, adequate healthcare for all people, is needed in this country, and it's long overdue. And we just need to come to a point where people who are greedy and selfish need to just shut up, you know, and sit down and be quiet. You know, you have access to healthcare, you have adequate healthcare, and you can go to the hospital and get it taken care of. So that same right should be provided to every citizen of this country. You know, just because you have money, you can go to the hospital, you have coverage, you can provide healthcare for your family. Does that make you special? No, it doesn't. You know, does that make you better? No, it doesn't. You know, playing with people's lives isn't a joke. And we shouldn't play with people's lives when we can provide healthcare for those people that deserve it, that need it. I mean, just because a person is not as fortunate as another person as far as financial means doesn't mean that person has to suffer. Should mean that person should suffer because of it, especially when it comes to health. Of all things, you know, health should be like a given to all citizens. Period. People, stop being greedy. People out there who are against healthcare reform, stop being selfish. So hopefully this will pass. Hopefully this will be done with this weekend. Hopefully we can get this thing through and open up a new chapter in healthcare reform and the healthcare system. This is Black Thought Media, 2010, signing off. Peace.